Good afternoon, everyone. Am I audible? If anyone can just let me know whether I'm audible.
Yes, sir. Yes, sir.
Okay, thank you. So, a warm welcome to everyone for today's R2R program. Today's R2R program, I think we thought about learning more about autism and speech and language uh, therapy. So basically, we know that a person with autism will require will require therapy sessions multiple times, and we have discussed on multiple forums about the requirement of the person with autism to continue the therapy, how to start a therapy, and all those things. But one thing that we need to address is that a caregiver is a integral part of this therapy, and the caregiver participation is for utmost importance. So we thought of just to let them know like what exactly it is and how it works and all the aspects that is concerned with the speech and language therapy. We thought we will discuss today. So we have our guest today. Uh, Yes, we have two enthusiastic guests today who were kind enough to accept our invitation and to be part of this R2R program. I would like to introduce Dr. S.S. Meera. She is Associate Professor of Department of Speech Pathology and Audiology. She works with individuals with the communication disorder across the lifespan. She is a Fulbright Nehru postdoctoral fellow, India Alliance DBT Wellcome Trust fellow, and she has established infant toddler language development and intervention lab. It is called LIL, I guess, right? Yeah, that's a nice acronym. And yeah, this is one of them. And let me also introduce our other participants, Dr. Malvika Srikar. She is a speech language pathologist, and she has completed the PhD under guidance of Dr. Meera, and she has been awarded with uh, NSA Research in Autism and Cultural Diversity. And of course, she is enthusiastic about providing tele-intervention for individuals, which augurs well with what we are doing right now. So, without much ado, I would like to introduce like I would like to call upon both the participants to take over from here. Ma'am, please.
We can everyone. It's afternoon where I am from, but I'm sure that there are people across the globe. So good day to everyone joining. It's our absolute privilege and pleasure for both of this discussion because we hear this has been going on for a while now. It's just quite a good response. And so I do want to start by saying that I acknowledge that a lot of you here are caregivers of autistic individuals with young children. And so we do recognize that you all are equally experts, but experts by experience. So while we are going to give you our perspective, to our perspective as well, we hope that the session will be a mutual learning session. And so we've decided to title this talk today as a caregiver's guide to speech and language. And this is through our lens as speech language. So as you can see that I've broken down the title into parts. And so one of the first thing that we will talk about is what is speech and language, just to make sure that all of us are on the same page, acknowledging that many of your caregivers here are likely to know this. We then will talk about speech and language in the context of autism and related disorders, followed by speech and language therapy, which is the main part of this talk for autism. And ultimately kind of tie up all these aspects to kind of end the session. We also hope that we will have some time to kind of talk about killer scenarios so that get an idea of how we work. That's not okay. Okay. I just want to double check one of you if you can just tell me whether my audio is clear and to hear, because I do know that I have a sore throat, so I just want to be sure. Can one of you please give us a thumbs up or respond? Hopefully, all of you can hear me. Okay. Okay. Just give me.
You're not very audible.
Okay. Just give us 1 minute. We'll just redo the calibration of the audio and get back to it. 1 minute. Sorry about that technical glitch. Can one of you please tell me if my voice is clearer now and if the network is okay?
Yes, it's better now, ma'am.
Okay, thank you. So I don't think I spoke about anything so far that in terms of concepts, but I just wanted to say that we have broken down today's title, A Caregiver's Guide to Speech Language Therapy for Autism, into these bits. So we'll start with what is speech language in the context of autism, then therapy in the context of autism, and tie everything together. And with time, we're hoping we will be able to have that case discussion as well. Okay. So we next have like I said, we'll start with what is speech language and communication, just to make sure that all of us are on the same page today. And I do recognize that there are caregivers who will all know this, but I just want to do this so that we're all starting at the same point. For this, I want to introduce language first. So for Malavi and I, or any speech language pathologist, these three are distinct terms. We look at speech separately, we look at language separately, we look at communication separately. So the first thing that I'm going to start with is what's language. So language in our context is not English, Hindi, Kannada. It is the code. It's like a code in the brain, sitting in the brain. There is a code that is there in all our brains that could be either Hindi, Kannada, English, whichever language, but there is a code. And that code helps us understand information, understand what's told to us, and that same code is responsible to help us express ourselves. So language, which is a separate entity, is not the same as speech. And language is a code in the brain. And this is the code that helps us understand and also helps us express what we want to express. Now, understanding can happen through multiple modes. And as all of you will know, autistic individuals have different methods of understanding things. The most common method that we usually talk about is listening. So we hear somebody say something to us, we listen to it, it goes into the code, it gets decoded, and then we respond. So listening is one way of understanding. Observing and seeing our environment around us is another way of understanding. Another way of understanding for older children and all of us as adults is to read. So all these three components, yes, as a speech language pathologist, I'm telling you reading and writing is part of language. So there are other ways also. So you listen, you observe, you see, you read. All this is understanding, and that is a code that is there in our brains. Likewise, when we come to expression, so I'm expressing myself today in the form of speech. I'm speaking to you all. I'm also, if you see my video, I'm also using a lot of hand gestures. I'm looking at Malavi, I'm looking at people around me to see whether they can hear. So I'm expressing not just using speech, but in today's context, I'm using speech and nonverbal, where I'm using gestures, my eyes are communicating and things like that. In addition to these two forms, older children and adults, we also use writing, SMS, messaging services, which is again writing. These are all forms of expression. So at the cost, I know that I'm repeating myself, but I want all of us to be on the same page. We have language, which is the code in our brain. And that is largely understanding and expressing. In understanding, we have these different methods. It's not just listening, it's everything else. Expression is not just speech. That is one part of me. Whereas with me, I'm also using other forms of nonverbal communication. So when we are looking at language, just language and neurodevelopmental research, any form, we are looking at this whole picture that's there in this slide. Okay. So with that understanding, I'd like to switch gears to what is communication. Now, all that we spoke about understanding, if I do it for myself in my head, or if I do this in front of a mirror to myself, that is not communication. Communication is when I have a partner with me, I have a little child with whom I'm going and talking to, I have a colleague of mine with whom I'm talking to, I have a bunch of friends with whom I'm. So while language is the code, we use that code to communicate, and for communication, it is at the very minimum to. And that is where, while language is difficult for autistic individuals, I understand that, but also that communication. They may know things, but they may not know how to communicate with another individual, or they may know, but they may have a slightly different way of doing that. And that is where, because communication is two-way, while we help autistic individuals become better in their language and communication, it is equally my responsibility as an adult, as a caregiver, to also understand their communication. So what am I trying to say? That communication is a two-way process it is a two-way process and requires at the very minimum two people. It is the exchange of ideas, information, and everything else. For good communication, we need good language. And let's not forget, language is a code, it has understanding, expression, it has all those things on the side of the slide. And any form of language is acknowledged as communication. So we have now defined language, we have now defined communication. And I'm now going to speech, which is one of those things that most people think that speech language pathologists work on speech, speaking. Yes, we do work on that, but that is one of the smaller pieces that we work on. What we work largely especially in autism and related developmental disorders, is on language and communication. So just to make sure that we have defined speech as well, it is one form of expression. Expression is a language, is part of language. And in order to be able to speak clearly, in order to be sounding fairly clear, in order to be able to articulate clearly, we need to have coordination of a lot of different structures here, especially the respiratory system, what we call the voice box, the laryngeal system, and the articulators. So that is speech. So speech is really this part that we are working on. But what we really focus when autistic individuals come to us seeking speech language therapy is language and communication. So that is the focus. And today, since we have chosen to speak about autism, we are going to focus on language therapy, communication therapy. Who provides speech language therapy? It is a speech language pathologist who's qualified to do this. It's a 4-year plus 2-year degrees. We're trained to understand what is speech, what's language, communication, and do it either in the form of providing continuous sessions or having 1 or 2 sessions a week, or let's say a follow-up model where the family comes once a month and then we provide them with next steps, they come back another month, or what Malavi specializes in, tele-intervention, where she meets families online, and also some things like providing feedback and things. It's a different topic in itself, but speech language pathologists provide speech language therapy. A quick check about audio. Is it clear to everybody? So, all right, thanks, Divya. Okay, so what is speech language therapy is the focus of our topics. I'm going to leave that to Poppy. But very quickly, again, just to be on the same page, we're looking at what is autism. It's a neurodevelopmental disorder that emerges in childhood. It ranges all the way from mild to severe. It impacts language and communication. One form of language is speech. In many other areas, as all of us know. And language and communication concerns is almost a concern in every autistic individual. So I think one of the things that we are really stressing and we're trying to make it happen is to bring the age of intervention, that is therapy, much earlier than what it is currently. Again, language and communication concerns in autistic individuals can range from mild to severe, can be as simple a task as pointing to something or an eye gaze to say, I want to talk to you, which starts in early childhood, less than 12 months of age. 1-year-old babies should be able to clearly point to their needs and should be able to maintain needs. All the way, that entire range of things that we do as speech language pathologists comes all the way this side to be able to negotiate using speech. negotiate using written communication, negotiate using non-verbal. So there's a range of things that we do, and we cover the entire lifespan. Again, I'm stressing on this. Therapy matters, and all the caregivers here, I'm sure, are sensitive to this and earlier. Okay. I know Malvi's going to touch upon this briefly later on this very same slide. But like I was saying, that concerns in speech language concerns in autism. I'm switching the word to language and communication concerns in autism. Goes right from what you see on this side of the slide, which is pointing, all the way to verbal negotiation. The two ends of it. Pointing, what we think, oh, that's such a simple skill, is hard for some autistic individuals. Verbal negotiation is to be able to say, for example, I don't want to come with you for a wedding now. Let's say an adult says, I don't want to come with you for a wedding, but I'll surely help you clean up, wash all the dishes tonight. So you're negotiating, saying that I want to come, but I'm going to do these things. Within that, there are multiple other things that we are doing. In the interest of time, I've just touched upon 4 things, which Malvi will describe later on in our session. But gesture-speech combination is something that I am using as I talk to all of you. I'm using my hands to communicate. I'm looking at people. So that is gesture and speech. While all of you, many times we find ourselves saying that we have to focus on speech, speaking. But as adults, we all use speech and gesture combinations. So our expectation of an autistic individual, our expectation of an autistic individual's therapy has to be a combination of, if possible, speech, otherwise all forms of communication. And expressing emotions is a concern of multiple caregivers. There again, saying that they must say that I'm sad, I'm happy, I'm sad, using their speech may not be the only way. That is one way, but also to be able to say that I'm sad by pointing to a picture or by having a specific way of doing it. That also comes under the purview of a speech language pathologist, where we are focusing on language and communication. Why is it important? We all are in a society that communicates. We all communicate with each other. But most importantly, I think what I've heard from all the caregivers that we have met for the decade here is that the moment they understand why a child is behaving a certain way or hitting their head to the wall or lying on the floor, troubled about it, is usually because I'm not saying every child is the same story, but is usually, if you're able to break it down, there is a communication issue there. They are really upset that the caregiver, whoever it is, or let's say a teacher, did something a certain way and they're not able to say what upset them. And also that they don't feel regulated enough. So that's the best they know and that's how they do it. So we've come to understand that understanding their communication abilities, readjusting to their communication abilities is as important as we expecting them to communicate like us. And that the more we work on communication as a whole, not speaking alone, any form of communication helps in reducing challenging behaviors. I'm not saying everybody, but definitely a big chunk of it is because they are not able to communicate what's going on. So with that, I just like to hand it over to kind of take us through the next set of slides. What we decided today, Dr. Nishanth, for the session was to tap into our own experience of working with autistic individuals for the last 10 years across the lifespan and kind of discuss the intervention package. I wouldn't call it a program yet because we're still working on researching it, evidence bases, a lot of steps on the research side of things. But in the clinic, we have developed this package that we kind of use to support caregivers as to what they can do and also what we can do children and adults directly. And so this is some of the things that we are doing in our lab, which is primarily focused on language intervention. So that is what my will talk about. Just checking if I'm audible.
Yes, ma'am.
Thank you so much. Thank you, Dr. Meera. So as Dr. Meera mentioned, in our lab, we're developing an intervention package. Our lab is called the Language Development and Intervention. So this package that we're talking about today is caregiver focused. So there is a lot that we do as speech language pathologists. And as Dr. Meera mentioned, communication is a two-way process. As much as we need to directly work with the autistic individuals to improve their communication, we also are trying to come up with something to help the caregivers. So the caregivers can facilitate the communication in the autistic individuals. So these are not necessarily caregivers. These could be caregivers. It could be the autistic individual's friends. It could also be professionals who interact with the autistic individual. So the basic foundational principles that we have used to come up with this is applicable mostly across all ages and for most individuals with communication needs. So the three main components that we would like to talk about is first, understanding the autistic individual, because there are many a times where they are trying to tell us something, but we're not very sure if they are telling us something, and we're not very sure what they're trying to tell us. The second is, how can we speak with them and how can we respond to them in a manner that is easy for them to understand, in a manner that is easy for them to respond back to us. And using these two, we come to the third point, which is how do we maintain communication cycles. So what we mean by a communication cycle is the conversation turns or the information exchange that happens between the two communications. For example, an autistic individual may say thirsty, and then the communication partner may say, would you like to drink some water or would you like some juice? And then the autistic individual may point towards the water. So this is what we would describe as a communication cycle. So how can we help caregivers and communication partners facilitate this continued exchange of communication with the autistic individual is what we're trying. So the first thing that we want to talk about is understanding. So many a time we hear concerns that this person is not communicating at all. I think we would like to rephrase by saying they are communicating, but they're communicating in their own way, which may be different from what we are used to in our general context. So the very first step that we need to do is we need to identify how are they communicating. As Dr. Meera mentioned, communication could be verbal, it could be non-verbal, or it could be a combination of both. So verbal could be as simple as vocalizing, like a grunt or a firm voice to say that they are not interested or they're not happy with this, or a happy voice. So one very basic way to verbally communicate would be through vocalizations. It could also involve using words. For example, in the example that I just mentioned, an autistic individual saying thirsty is using a word to communicate. They could also use phrases like I want water, or they could communicate in complete sentences and combine sentences to communicate. On the other hand, non-verbal communication, as Dr. Meera mentioned, could be as simple as an eye gaze, where they look away from you to say that they are not interested in what you're saying, or they're upset with what you say, or they look towards you to grab your attention. It could be facial expressions. It could also be unconventional communication, such as hand leading, where they grab the hand of the caregiver and they lead them to the object of interest or lead them to the place where they need some help. It could also be that instead of pointing at something, they may take their hand and place it on top of that object to indicate, can you please open this for me? And of course, it could also involve gestures. Gestures could be as simple as shaking their head for, or it could be pushing something away to say that they are not interested in. It could be reaching their hand out to say that they want something, or it could be pointing. So there are many different gestures that they could use to communicate. And often at times, they use a combination of both. Maybe would you say, so we decide that we do this as a dialogue because we like to be as natural as we can. So would you say that vocalizations, what you explained as a grunt or just a sound, can also be the level at which an adult is? And in that case also, would you say that is important, right? Or are you referring to children? So I think it's very possible for adults also to be at a level. So there may be some autistic adults who are severely autistic and who do not have the current ability to speak in sentences. Or they could just be somebody who chooses not to speak. They could have a preference for not speaking. Maybe because for me, English is easier than Hindi. For them, vocalizations may be easier than sentences. So their go-to communication pattern could be vocalization. It's not necessary that somebody who knows how to use a word will not vocalize. So as Dr. Meera is nodding and saying, which is also equally as communicative as saying yes. So identification is about in any age, it could be as what we learn as babies, vocalize, all the way to sentences and arguments, all the way, the whole end to okay. So the words, okay. Similarly, just looking could also be communication, or using a complex gesture could also be. So you're saying in the first part of the guidelines that we provide caregivers in the session, when they come to us and spend time, we say that communication, everybody communicates. There is no debate there. But identifying how they communicate is a key component. And I want to say, I don't know whether you agree with me, but it's not just caregivers, teachers, professionals, across the board. Sometimes we find ourselves not paying enough attention to, as they enter, to first acknowledge that they are communicating and how they're, because we're so hardwired to say they're not speaking, but actually, no, they are communicating. Which is why we say in our very first sessions that we do with our caregivers, with their peers, we say first just watch and see how they behave, see what are they doing, how are they doing. And there may be many subtle things that you pick up just by watching them that you would not have noticed in the past so many years. Yeah. And with that, we come to the next part, which is interpreting what are they trying to say. So as we were just talking about, it could be an eye gaze or it could be a vocalization, which is much harder to interpret than something that is as direct as asking through a gesture like this or saying a word as this. So here what we say is that we need to look at the context in which the individual is communicating. And this helps us. This is better. And this will help us understand what they're trying to say. So for example, we bring a chapati in front of the autistic individual and they look away from the plate. Every time you bring a chapati, they look away from the plate. Maybe they're trying to tell us that this is something that they do. Do they also look away from other things that they don't like? For example, they don't like sticky clay. Do they look away from it in a certain way? So this is why it is important to observe what they are doing in that context and across different contexts, which will kind of help us interpret what is the individual trying to communicate with us. And as Dr. Meera mentioned, as and when we are able to understand them better, then there are fewer communication breakdowns, and we've seen that this also leads to fewer challenges. So if they're screaming and shouting about something, is it just a temper tantrum, or is it a sensory regulation issue, or are they very upset about something? But we are not able to understand what they're upset about, and they are not able to tell us what they are upset about. I was just thinking, we've both spoken about this, that is this too simple for an audience of caregivers? Caregivers know this, but we also have professionals. But what I want to tell, probably for the professionals and caregivers too, is that as simple as this may sound, it's sometimes we tend, in all the hustle and the hustle of life, we kind of forget about these things. And again, we get stuck on the fact that they're not speaking and then going down that path. But actually, the moment we've heard so many caregivers, such as they say to us that the moment we have understood these fundamental concepts, building on their language and communication and speech becomes a lot easier. Yeah. Absolutely. And with this, we lead to the next part, which is speaking to and responding to the individual with the autistic. So starting with responses, we say that responses should always be immediate, which means that as soon as they have said something or they have shown us something, we must immediately respond. And it must also be relevant to what the autistic individual is. So for example, if the autistic individual is sitting in a therapy room and they need to finish therapy, but they say water. So our general response tends to be look here or focus here because there's not a water bottle inside. But a more appropriate response may be, would you like water? You can have it after the session and then continue saying look here to this. So often a time we forget to respond to what they have said. Just double checking that we are audible. You can see that there are a lot of comments in the comment box. We're trying to be.
Yes, ma'am, you are audible, ma'am.
Okay, we're trying to be as loud as we can. So just want to make sure that otherwise we'll have to scream into the mic next. So just keep letting us know whether you're able to hear on the chat box. We are monitoring the chat box. Thank you, everybody.
All right. So, as we were saying, when we respond to them, we have to immediately respond because once the autistic individual has said something and we take, say, 10 or 15 seconds to respond, then they may not associate that what you are doing is in response to what they said or what they did. And then we always have to acknowledge what they are saying, even if we want to bring their focus back to something else, or if what they said is not relevant to the situation at that point. We have to acknowledge what they said and then move on.
That was not by me, it's just there.
Okay. Okay. And the second thing that we want to say is that we only talk about being developmentally appropriate with children, but this is something that we have to think about throughout the life because there may be an adult who has limited comprehension of verbal language. So with such an individual, we will always try and use short, simple phrases. We will stress on the important word in the phrase because when we say many sentences together, it may be difficult for them to understand words. So that's why we say use short and simple phrases so that it is easy for them to catch what you are saying and always stress the important because some individuals may be visual, they may not be auditory learners, so their attention to speech may be limited, in which case this is a very useful strategy. Of course, if their comprehension is much better and they're in a position where they are able to understand longer speech, then you can, of course, put sentences together, give them multiple instructions in the same. So we have to know where the individual is in order to know how to.
Just give us a minute. Seems to be tech issue after tech issue. Just give us one moment, please. It's artistic work that we have not really done. But as long as it's not distracting you, those two little graphs that have come up for I don't know what reason, we'll go ahead.
And the next thing that we want to say is that sometimes it may be preferable to have multimodal communication. As I just mentioned, an autistic individual may not be very attentive to speech. So in that case, like how I'm using gestures while speaking into the camera. When we use gestures or when we have a picture card with us or when we have different modalities of communication together, it may be easier for them to attend to what we are trying to, what information we're trying to give. And it may become easier for them to respond. So as we said that their communication could be verbal or not, our communication to them could also be verbal or not, or a combination of different things. For example, if we want to say, do you want to go to the restroom? Do you want to go to the washroom? We have a picture of the washroom with us, or if we have a symbol to indicate restroom, it may be much easier for the autistic individual to respond. So our communication to them could also be multimodal. And how multimodal it is very individualistic. It depends on the individual that we are communicating with. And I will touch upon some of the ways that we could alternatively communicate with them in addition to or instead of speech in the lectures. The last thing we want to talk about is when we are speaking to autistic individuals or when we are responding to autistic individuals. There are some facilitation techniques that we commonly use in speech language. And we're going to describe some very basic, very easy to understand, but very efficient and very important strategies that communication partners could use. The first is modeling. So sometimes when we ask the autistic individual something, they often don't know how to respond. So sometimes when we ask a question and we give them the answer, it becomes easier for them to communicate. So for example, if we say, do you want water? And they're looking at us and they're not very sure how they should respond. We say yes. It may be easier for them to understand, oh, I have to say yes or no. Me not saying no does not imply that I do. So that way, sometimes it is useful to model the response that we are expecting from the autistic individual. Another way that we could do is binary choices. Often when we ask an open-ended question like, what do you want? Where do you want to go? It becomes difficult for the autistic individual to respond. So instead of saying, what do you want to eat? We could say, what do you want to eat? Do you want chapati or do you want rice? And when we give them the two options, it often becomes easier for them to respond. They could either respond by copying the word and repeating the word. They could respond by pointing what they want. They could respond by looking in the direction of the thing. So for many things, when we give them choices, it becomes easier for the individuals to respond. Third thing that we could do is
do binary choices, it's easier for us to understand.
Yes,
It's both
absolutely.
ways. It's both
Absolutely.
ways. So I always feel that many times, even in the clinic, when we are here, it is not natural to immediately draw things or immediately pick out the cards from your drawer and provide it to our autistic individuals. But if we are able to, at every given point, which I think we are now implementing, is to have choices ready. And now many of our families carry those choices with them, bring it to them. I almost feel a big battle is one, because they know that we know what they want to be asked. We know that they have a way of communicating. It's both way. They in their mind are like, thank God this adult, this caregiver, this teacher, this clinician at least knows that this is how I want to communicate. Thank God they have options for me to communicate. Because many times we're sitting like this, show me this, show me that, do that. No, if we want a child to communicate well, quote unquote, if we want an autistic individual to come and be like us, we have to be like them also, which means that we must, in our clinic, in our outings, everywhere, have those tools in our hand ready to be placed, or we must be good enough to create them immediately and provide choices. So binary choice as a technique, as a facilitation technique, is a big thing that we have in our speech language pathology kitty. And I know that many other professionals use binary choices, but that has to be like almost like 100% there all the time, everywhere, like a breathing system. No? Like wherever we go, we breathe, we take our system with us. So that's how binary choices should become that natural. Okay.
Another thing to remember is that binary choices could also be multiple. As Dr. Meera mentioned, it could be a picture card. And if you don't have the picture card with you, then you could say, for example, would you like to switch off the fan? And you point to the fan when you're talking about the fan. That may become easier for them to respond to you. So you could always use the combination of gestures and speech, or gestures and pictures, speech and pictures, while giving them these choices. So it becomes easier for them to respond.
Bhuvanesh, which part would you like us to repeat? If you can just tell us which part, we'll repeat it for you.
Put it in the chat boxes.
The previous point, which is the binary choices, is that what you're asking about, or extend and expand? If you can just put binary choices or extend and expand, we'll touch upon it.
Yes.
Yes to
Yes to, yeah, previous point, binary choices, I think. Yes.
Okay. All right. We'll do that again. Thanks.
So what we mean by binary choices is that when you ask an open-ended question to an autistic individual, it may be difficult for them to respond to us. So if we say, what do you want to eat? What do you want to play? It may be very hard for them to come up with a response. So what we mean by binary choices is when you ask them a question and you see that they're struggling to respond to you, then you give them a choice. For example, what do you want to eat? You say, do you want chapati or do you want rice? And you give them a choice. If you say, what do you want to play? You say, do you want to play with your puzzle set or do you want to play with the new cars that you have? And you give them a choice.
They're on the floor and in a tantrum. Binary choice may not be the best there because they're trying to regulate themselves. But in some cases, we have found that just providing them cards saying, leave me alone versus quiet time, anything, I need help, whatever. If that's already something that they've used before and that card is readily available, and we can judge that, I mean, because they're trying to regulate themselves at that time, going and stuffing things and they sometimes may not work. But if it does, then that's a binary choice. So rather than saying, what happened? Why are you rolling on the floor and crying? That's like such a big demand. They may do it, may not do it. But instead, if you had that choice with a card that's already familiar, that is a great place to also be able to I mean, every place, a binary choice is a big, in my opinion, a game changer, actually, if I can use that word.
And like we just mentioned, the binary choices could also be multiple. It could be a combination of speaking and gesturing, of pictures and gestures. What we will touch upon this in a little bit more.
And with some examples that Shubhra is asking.
We will come. Yes. And the third thing that we wanted to talk about was extension and expansion, which basically means when the autistic individual is saying something, we could repeat what they're saying as a way of clarifying, is this what you meant? And as a way of, giving them a model on how they could be clearer in what they're saying. For example, an autistic individual says water. So you could say drink water or Is the water spilled? So you could repeat what they said, acknowledge that they've said something, and then repeat it in a way to get more clarity from them, or repeat it in a way that, next time they want to say water, they know that they can say drink water because they've seen that model.
Yeah. So again, we're just, okay. So I think one of the things that I can see is that all these are for caregivers.
Yes.
All these are for professionals. All
Yes.
these are for all five of us sitting in this room. That we are doing extension, we are using expansion to facilitate a child or an adult's communication.
And the last thing that we want to say is contextual reinforcement. From when they were children, we've always had a habit of saying, good job, very nice, yay, well done. But what we've realized that really helps, especially as they grow older, is contextualize the reinforcement. Because often they would not realize, what are you praising? Are you praising them because of drinking water? Are you praising them because they drank the water and kept it in the sink? Are you praising them because they didn't spill the water? So sometimes when you say, oh, you're all done with your task, good job. Or you say that, oh, you put the glass in the sink. That's great.
So give them the example of why they're good. And so every time saying, hey, good job, which is like, I find ourselves doing this so often, right? Good job for adults, maybe we'll use this, or for children, we'll use this. Good job for what? If that kid could have asked you back, they were like, what, Ma, you're saying the same thing, good job. Why, auntie, are you saying the same thing? So I think what we're trying to together say is that while reinforcements are important, it has to be contextualized. And when you do it for language specifically, the task is done, but for language, that is, they understood the task and did it. You're saying that you understood and did it, or whatever. Contextualize the reinforcement rather than using it as one go to say, good job, good job, good job.
Yeah, I agree. So if they cleaned up after themselves, then you say, good job cleaning up. So, because otherwise they would think that you're praising them for getting up from the chair and leaving because they cleaned up and then they got up from the chair. So it's always good to specify what we're praising. And it's also in a way reinforcing what they did or what they said. So it has a positive.
Yeah. So this was all about speaking and responding. So we spoke about immediate and relevant responses, developmentally appropriate. We are acknowledging for adults also there is a certain appropriateness, multimodal communication, which is not all about speaking. We also use multimodal communication because sometimes autistic individuals, any one of us for that matter, may recognize the gesture and may have zoned out of what was told. So that and all the facilitation techniques.
Yeah. And it is also useful for dumb people also catch us very easily, all these techniques, right?
Yeah. I can only see Motorola there. I'm sorry, I don't know your name, but it would be nice if you can please leave that question on the chat box. We will respond. We will come to that and we'll respond. Thank you for your question.
Okay, Rupa.
And as we were saying, coming to the third point, which is helping conversation partners, communication partners, understand the autistic individual and respond to the autistic individual, leads to the third and very important aspect, which is what we call communication cycles. Like I mentioned, this is the exchange of information between the two communication partners. That is continued. It is not that I want water, here you go, that's it. So you can build on. So if they say, I want juice, and you say, oh, would you like the juice hot or cold? And then they say cold, and then it's like, here you go, would you like more? And then they show their hand to say that it's enough. So in this way, what you say with juice and giving them juice, you're building this into a multi-level, multi-step communication exchange, which is very important, especially for autistic children, because as we know, social communication and language is something that is a big challenge. So this slide or this information is basically on how can we continue to have a communication exchange with the autistic.
And the exchange can be anywhere from 2-3 rounds all the way to a full-fledged dialogue, sometimes to an argument. It can build up into anything, right?
Yes.
So do you think you and I could do one spontaneously? Okay. So let's say I'm going to start. So I'm going to say, are you done talking? Not yet. Oh, I need to go. Stay. Okay, I'll stay with you. You. So you saw that Malavi used non-verbal and verbal, and I was looking at her, and I also was looking at her non-verbal moves to do that. That's a communication cycle where there is a to and fro. And very often we find ourselves saying, only if you speak, I will give you. Only if you say this, I will do this. And there's a need to keep saying, say it back. And we are also not using other modes. That for us as a communication cycle is a huge challenge because all of us use non-verbal and verbal. And the more we facilitate non-verbal, Malavi, we know from literature, from our own experience, it pushes for speech production. It will never take away from speech. The more multimodal we use, all modes, all senses, the more we facilitate and not make an autistic individual nervous about speaking, not put the pressure on them, it actually pushes for speech production. That's time and again proven. So that fear should not be that. We should say that all modes of communication are accepted. And in fact, that will help in speech production.
And one example that we very often use is, if they're pointing to the water bottle and you're like, say, give me water, that's very similar to me saying pani do. And they're like, unless you ask me in English, I won't give you. And for me, it's very confusing because I've clearly communicated what I've and I know that you've understood what I've. You're still asking me to repeat. So for me, it doesn't make sense. So when we see communication cycles from an autistic individual's perspective, then we are, it's easier for us to understand why multimodal is so important, even though for us maybe speeches may seem primary.
Yeah. And I'm reminded of this very important example. In fact, we both conducted this workshop in Hyderabad, and this is a professional who's also a parent of an autistic child said to us. So we say that, do you want water? And the child said yes. And then the caregiver, and then the next thing that the therapist was telling her, speak in full sentences. When Malavi asks me, do you want water? I say yes. If I had asked Dr. Nishanth, do you want water? He would have nodded and I would have given him the bottle. So why are we going behind? Why are we saying that you have to say it in full sentence, saying, please give me water? That does not make sense. But the same sentence structure is important in a different context. So as speech pathologists, we will work on sentence structure if required, but not in unnatural ways that we don't do but expect autistic children to do. So just like trying to bring this in time and again for all the professionals and the caregivers on the call, and many students that I can see on the call as well, that some of these things we have to apply common sense and we must ask ourselves, would I have done this? Would I have put myself or would I put Malavi through this situation? If I've understood, then move on.
And another very important thing about situations and context is that we often say, give opportunities for your child to communicate. Give opportunities for your child to understand what you're saying and follow what you're doing. But what happens is some of these opportunities are not meaningful for the child. For example, it's a hot day and the fan is on and you give an instruction saying, can you please switch off the fan? The autistic child will have very low motivation to do it because he likes the fan. Or it could also be that you say, go give me water, and then you take the water bottle from them and you leave it on the table. So the next time when you say, give me water, they'll be less inclined to do it because they're like, why are you even asking me for it? In the same communication context, if you had done, say, during meal time, when you're having a meal with the autistic individual and say, pass me the water bottle. They give you the water bottle and you say, thank you. And then you drink the water bottle. And then you ask them, do you want some? And they shake their head, no. Here, the motivation for them to communicate is much higher because it is meaningful for them. The motivation for them to listen to you and try and understand what you're saying, or watch you and try and understand what you're trying to tell them, becomes much more meaningful for them. And they will be more involved in the communication that is happening, rather than something that is not related to what they are doing or something that they are not interested in. So one thing that we always say is, even if you're trying to say, increase their understanding, or you're practicing any of the other strategies that you have with them, always put it in a meaningful context. So it becomes easier and more relatable for the autistic individuals. And try not to, another thing about motivation is to try and move away from the Q&A form. Don't keep saying, do you want this? Do you want that? What do you want? Can you tell me this? So the more demanding we become of them, the less inclined they become to continue to converse with us. So when we move away from the Q&A format, and as Dr. Meera mentioned, we stop demanding that they respond to us in a certain way, we see that automatically the resistance to join the conversation reduces. and they're more inclined to be involved or more inclined to participate in the communication skills that we're doing. And another very important thing is a lot of caregivers tell us that he doesn't have the interest to speak with me. He doesn't have the interest to communicate. So what we think is very important is, or one of the first steps actually, is to increase that communication content. How do you do that? By conversing about topics that are of interest with them, about conversing across activities that you are doing with them that they enjoy doing. And when we are doing something that is of interest to them, they automatically tend to pay better attention. They tend to be involved better, and then they hence tend to communicate with us. So we always need to ask ourselves, are they motivated to join me in this activity? Are they motivated to be a part of this communication sector? If the answer to that is yes, then it makes a lot of other things easy. If the answer to that is no, then we know that they're already starting from 2 steps back, which makes things very difficult. And the third final thing that we would like to say is some things that we call conversation repair strategies. This is, of course, a complex concept, and we in detail discuss it and explain it in speech language therapy. But to talk about it in a very easy to understand manner, if you are not able to understand what they're trying to say, try and repeat, try and clarify and say, is this what you're trying to say? Another thing is you have told them something, but they don't seem to be responding to you. Either repeat yourself because they may not have paid attention the first time, or rephrase what you say, make it shorter, make it more simple, or rephrase in a way that first you only told them in a spoken way, but this time you're supplementing it with gestures. So if you feel that you're not getting a response from them, try and modify the way that you gave the first thing. Because often we see that we have a tendency to repeat the exact same thing 3 times. If they didn't respond to you the first 2 times, then the chances of them responding to you the 6th time is also a little less likely. But when we modify the way that we ask something from them, it becomes easier for them to respond. And when you do this 4 or 5 times across 4 or 5 weeks, then you get an understanding of what is easy for this autistic, what is easy for my child, what is easy for my patient. And that helps us communicate.
Like all of us have dialogues between any 2 people. If we find that they have not understood, unless we are really like in a different zone that day, we definitely make accommodations and change the way we do. So the idea here is when we do it, when we make adjustments to understand each other, communicate with each other, we have to do that autistic approach. So you may turn around and say, then if they're at that level, do we keep making those adjustments? No, that is not what we are suggesting. Intelligently, because we are as adults and we are working with, let's say, with a child, we are intelligently making an increment, not saying that if that child is doing just a word, go with it. No, we will increase the level. We will help the child go to another level, yes. But we have to constantly check on how we are doing it first before we say that there is no progress, there is no change. Because many times we are as adults, as caregivers, as professionals, we are not making that adjustment and that switch. And conversation repairs are like so important for us to build communications
and to continue the communication cycles. Often what happens is there are 2 exchanges and then there's a break. So how do you redirect? How do you bring them back into the conversation?
And repeating is not always the answer. Like Malvi is very correctly added here. It's repeating, yes, try, that may work out, but rephrasing usually helps more than going 5, 6 times. Twice repeating, yeah, we also do it sometimes. So that's the thing. So Malvi, I'm just going to, right, this is really distracting, isn't it? Yeah. No, yeah. We will just try and exit PowerPoint and get back to this because clearly these 2 pink little artwork was not what we had planned to do. So exit. Just one more, please. Like while you can, type in all the questions you have for us, we just exited it. Thank you. So, Malvi, we then move to the. How are we doing on time, Dr. Nishanth? Do we have another 10 minutes?
Yeah,
5 minutes,
sure,
maybe?
fine.
We're trying to negotiate. Like I said, that's one of the complex skills. With all the technical things, I think we lost a couple of minutes. But And we're also happy to kind of quickly move to the, yeah. So Malvi, how about we touch upon the key aspects and then take some question answers. If we have the time, we can come back to that discussion.
Yeah. So apart from the three main things that we spoke about, which is understanding the autistic individual, speaking to, responding to the autistic, and building on communication skills. Of course, as Dr. Meera mentioned, there are many other things that we do in speech language. But some of the two key general overview things that we need to remember is the use of multiple languages. India is a naturally multilingual country, and in any household, especially in semi-urban or urban regions, it's very unlikely that they speak only one language. So we often hear parents and caregivers coming to us and saying, should we use only one language? Will many languages confuse my child? So from our clinical experience, and more importantly, from many years of research, we know that using two or more languages does not confuse the child. Using two or more languages also does not attribute or contribute to the language delay. Even as an adult, when you use one or two languages together, it does not confuse them. What is very important is that we maintain the naturalistic language environment. So in your house, if it is natural for you to speak a combination of Kannada and English, then speak a combination of Kannada and English. Because what happens is when you stop, say my native language is Kannada, but I stop speaking in Kannada and I only speak in English with my child, then what happens is my communication to the autistic individual becomes unnatural because it's unnatural for me.
And also becomes restricted.
And becomes restricted.
Because you don't know a lot of words in the other languages, like how do we do it? So you're actually depriving the child.
Yes.
If you forcefully use one language only.
And there are some jokes and there are some things, there are some ways of saying things in your language that may not map onto English. And when you don't know how to say it, or when you try and translate it, it kind of loses its meaning. And that emotional connect also kind of gets hit because you're trying to do something that's not natural for you. Already when communication is difficult for the other individual, we want to try and make it as supportive as possible. And we've already listed out so many different things for communication partners to do. So trying to like maintain a certain language will actually add weight on both communication partners. And there is also some literature that has said that earlier in life, when you introduce two languages, or any time in life, when there is a bilingual individual versus a monolingual individual who speaks only one language, the cognition is, something that we have seen that over time is sometimes better. Things like task shifting is actually better in individuals who speak multiple languages.
And if some of you here, I know, are caregivers of older children and young adults, because we understand that that's the group that we cater to from the PRS division, you all will have so many other parents coming to you and asking you. So whenever you get a chance, please, if of course the opportunity is right, please make them feel supported and confident that it's okay to speak in more than two languages, more than one language, as long as it's natural, as long as it is what the home environment, natural basically, and not to be worried about it, really not to be worried about it. And forcing one entire family to switch to English, for example, is hard. I'm not against English, but I'm just saying that we have to understand these things, because somewhere along the practice over the last few years, couple of decades now, it's become that. And I think a lot of our own professionals themselves, they use English. So, and I can see a very interesting question on sign language. We'll come back to that in the chat during the discussion. But thanks for that question.
And the second thing that we want to talk about is augmentative alternative communication. So throughout the talk, Dr. Meera and I have been saying that, communication is multimodal. There is verbal and non-verbal. And we have been speaking about many of the ways that non-verbal communication can happen. So there is a concept called augmentative alternative communication, which is a systematic way to communicate in a non-verbal. Now, this could be something what we call as low-tech, or it could be something that we call high-tech. So the first forms of non-verbal, or AAC as we call it, would be to use gestures, to use your eye contact, facial expressions, all of that. Another way to do it is to supplement your speech, or to use things such as, my pointer is coming on, but on one side of the screen, there's a blue box where you can see that there's a Velcro with pictures. So this is what we call as communication through pictures. So what if you ask the individual, what do you feel like doing in today's session? They pick up the bubbles and they stick it in the bottom yellow patch. And then you know that they're trying to tell you they like bubbles, because saying bubbles may be difficult for them.
Or has not yet come.
Or
Maybe come later.
Yes. It's not yet there. They're not there at that level. Another thing Dr. Meera mentioned is that when we're giving binary choices, we have to take it everywhere with us. So in the second picture that you see on the hand is there are pictures that are available on the wrist of the individual that they carry everywhere. The basic words that they would like to communicate in general, if we can put it on their wrist, then that is always accessible to them. So then they have the choice. They can either speak or they can gesture or they can use this. Like I have the option of either speaking in Hindi, Kannada, or English. They also have that option of multiple things.
So Malavi, this may be a good point for me to kind of jump in and say that I've always found that this is a very helpful thing that I say in the clinics to our caregivers is a lot of families are troubled about augmentative alternative communication because they feel that it may stop the child from speaking. So augmentative is to support, it's never going to stop. It's not alternative speech, it's actually helping the child to learn to speak. The second thing that I've found is very helpful is that imagine a situation where both parents want to go out for a wedding and your young person doesn't want to go. But you can't leave them just now at home alone. So probably they will choose to leave them with a neighbor. Now, if this person is not speaking yet or is not able to use words to communicate, not having provided them with other modes of communication puts the caregiver who's taking care of them while the parents have gone off for a wedding into a very difficult situation because they don't know how to communicate with them. So while the first thing about augmentative alternative communication is that we are not saying that speech will not come. We are not saying it is alternate. It is actually pushing for speech production. We are also saying by doing these things, you're helping your child communicate and be less frustrated. And if at all there is a situation that your child is in another person's house or in any other situation, other person who's communicating with your child will understand as well. Because we know that if you see the hand, and these are all standard pictures, versus if the child didn't have that and is crying, there is no way an adult can understand that. So there are multiple reasons why AAC is important and has to start from the get-go. Not wait till 8 years, speech bandilla, then come to the speech pathologist. No. Augmentative alternative communication has to start from the get-go. Augmentation is to support speech, is to supplement speech. Alternative is another thing for another day. But it has to be done from the get-go and can be as simple as what we've been talking about gestures all the way up until what we have in our departments like the eye trackers and what many people know as Avas apps and things like that. This is an entirely different conversation, Dr. Nishanth, for us to have. So we will just leave it at this summary and just kind of go into Q&A, see how time is, and then we'll come back. Anything else you wanted to say as like finishing?
Another thing I think is very important is that in the AAC or a lot of caregivers also have this concern that, oh, he will only be pointing at pictures. But what they don't realize is that you can have an entire conversation with just exchanging pictures, using a combination of gestures and pictures, using a combination of vocalizations, words, gestures, and pictures. So there are many, many ways to maintain a conversation with an individual. As we increase the support and provide them more modalities and opportunities to communicate with us, we often are surprised by how much we can communicate.
Yes, and that is where we really want caregiver buy-in. We really hope and wish that all caregivers at one point, all of us take time to accept, to go through the process. But when we make that switch to, okay, any form of communication is fine, it will support speech, and we are able to say exactly what you said, that even if you have a child as a yes, everything through pointing. You can communicate so many things and you will enjoy that communication. So on that note, we will over to you, Dr. Nishanth.
Yeah, I'm not visible, but I think I am audible. No problem. Let me first thank both presenters for their wonderful presentation. I think they covered a lot of aspects yeah, without much of a delay, we can go for Q&A sessions. I think we will start from the messages that has been already sent through the chat box, and then I think we can take up, or if anybody wants to ask any question, they can just raise their hands and we will come to you as early as possible. Okay. So first, yeah, I think Shubhra.
Yeah.
Yes.
Hello, sir. Hello, ma'am.
Yes, ma'am. Go ahead and ask your question, ma'am.
Yeah, thank you for this nice session. I am just, I should say that I'm just a kind of amateur. I got to know about autistic children because I had one or two students last year. I'm a teacher in school, not in India, outside of India. But my question is, I can't sometimes, communicate well with them. I was just thinking that if I'll just, sorry, I will switch on my camera. If I can sometimes, put two cards for the timing, because I'm thinking how to make it more practical, like with the, that tick yes and with a cross no. Does it work with them?
It does. Definitely it does. Yes, that is one of the ways. If the question is, does it work? It should work. But that's just one way, isn't it? Many different
Okay.
could do. So saying yes or no would be if you ask them, would you like this or do you want to go here? At the second point that they sit. That's one very important way of doing binary choices. Another way of doing it is, for example, in your classroom, if you have different activities that happen, things that you generally communicate with them or you would ask them. Then if you have a board which has these pictures, you can just pick out two at a time and say, what would you like? Like, would you like to do, would you like to go out to the ground to play? Would you like to sit down for writing?
Okay.
Or would you like to continue playing? So if you have like one picture for each of these, then it becomes, then your arsenal of being able to communicate with them. But of course, an important thing to remember is that this is a step-by-step process. First, we will have to kind of introduce the picture to the autistic individual and help them associate that this picture is equal to this. So as soon as you show a tick, it is not understood for the autistic individual that this means yes. So this is where you will have to model, and every time you say tick, you give it to them and then they understand that tick means yes. Then they will use the tick to communicate this. Understanding a child's vocabulary is the first step before introducing this. And binary choices is not just two things, it can be more than two. Yeah, saying two, but binary choices is for 4 box, 6 box, 8 box, depending upon the child that you are working. Thank you for that question.
Thank you.
Aparna? Yes, I think next question is from Aparna. Would you like to ask the question, or we can just read out the question? It is about what techniques could be used to break the repetitive thought pattern in case of autistic spectrum disorder? Yeah.
An example will help if you are I'm not putting you on a spot, Aparna, but just want to understand thought pattern. No, thought pattern can be multiple things. So I just want to know. Are you there?
You can unmute yourself, Aparna, if you are there. If you can answer.
We can wait for that question to come back in, and then we can take the next question. So,
I think there is the next question by Bimala. This is regarding the sign language. She's basically asking whether the sign language helps, and where can one learn the sign language is actually the question. I think, ma'am, you can go ahead and answer.
So, sign language is another language, like how Kannada and English and Hindi are languages. Sign language is also a language. And a lot of you may know this, but for those who don't, there are different sign languages. There is an American sign language, an Indian sign language, British sign language. So it's a whole language on its own, with its own grammar, its own vocabulary set, its own rules. And definitely sign language is a way that an autistic individual could communicate. Just like we were saying, you can use speech, you can use gestures, you can use pictures, you could also use language. The only tricky thing about sign language is that not a lot of people in India know sign language. So if I would sign to you saying, if I would say this, then I mean my father is coming. But you may not know that this means nothing. Yeah. Right? So that is one challenge that we've noticed with sign language. There are people who've done it. If your question is, can we do it? Yes. But the practical aspects of that, I will obviously think twice before we do that. Baby signs, and we do it more, and that's more commonly understood. Again, I'm bringing back the point that communication is a two-way process. While we are enthusiastic about teaching the child sign language, a child can do it, probably is excellent at it. It also means that communication partner, like Malavi rightly said, has to be able to do it. So that is where I will exert some caution. But is it possible? Yes. Logistics, we
one nice middle ground that we often do with families is that within the family context, you have certain signs, certain symbols that are conventional or representational of what you're trying to say. So that at least your family members will definitely be able to understand you, and hopefully the others will also be able to understand. The more concrete the sign or the symbol is, it becomes easier for communication.
We can go to the next question. I think it is from one of the PhD scholar, I guess. Let me check. PhD student and psychiatry at Nimhans. It is not without a problem. Okay. Okay, no problem. See, we can put the PRS mail ID at the end. If you want to communicate more, you can just communicate. And if you are in Nimhans, I don't think you have to bother much about it. You can just walk in.
Walk in our rooms.
Yes, ma'am will be available in a cabin. And please look at be at a reasonable time. Please go ahead and you can just check with the map. So next question, I think we can. I think we can go back.
Some sweet phrases are coming in. Thank you, everyone. About another session, I think that is for Dr. Nishanth and his team to kind of plan. But can sign language be different person to person? Maybe I'll ask you a question, just sort of, just to create a conversation around this. Can Kannada be different from person to person? You may say, yes, dialects are different, but overall the language form is similar. So if you can draw a parallel to that, if you're using the Indian Sign Language, it has to be that language. Just that is the code, pretty uniform. American Sign Language is slightly different from our Indian Sign, but that's uniform. So
where can we learn Indian Sign Language?
Where can we learn Indian Sign Language? Are you in Bangalore? Based out of Bangalore?
I'm in Mysore.
Mysore. Then All India Institute of Speech and Hearing, Mysore will be the place for you to definitely go and learn further. They will be able to give you all the resources.
Anything online, ma'am? Any online courses?
I don't know actually, Vimala, whether there are online.
A nice resource to tap into would be there are interpreters. So interpreters may not be associated with autism or speech language therapy.
It's the language.
But there are interpreters who sign for hard of hearing people with hearing impairment. So maybe if you could look for interpreters, then they could be.
Yeah, right. Definitely it's an interesting language. We've learned it in a bit. I don't think I'm conversant in it. I know it like how I know bits and pieces of Malayalam, bits and pieces of Telugu and stuff. But what I would like to say is, for a person who's hard of hearing impairment, there is a community of the deaf. They like to call themselves community of the deaf. Some people prefer hard of hearing. There is a community who speaks and does that. But for us, in this space of neurodevelopmental disorders, while we all, we can learn, of course, anything that we can learn. But I would just be careful about how we use it. But not that we can't, how we would use it.
I don't know.
Thank you, ma'am. Thank you.
Person to say, but is it out of the scope of what the discussion is, or is it okay? It's okay, fine. I think you have answered about the sign language. That is fine with us. And there are some queries about I think collaboration or some interactive sessions and all. We will put up a mail ID, PRS mail ID. If you want further communication about such things, you can write to us. So find the mail ID in the I think we will type the mail ID and you can just mail those things to us. Any more questions? If someone wants to ask any questions
on communication, on two-way processes, the main three things that we spoke about: understanding an autistic individual, communicating with them, and building on communication cycles.
I think there is one question about rail. Then again, I am not sure whether this is definitely out of the scope of what we are discussing today. So please, uh, uh, any other questions related to this our topic? Please, people can raise hands, put a message, or go ahead. I think you can unmute yourself. If you have not restricted, you can just ask. Any students or anybody else wants to ask any questions, they can also go ahead.
Including Vanshita, she can discuss.
Yes.
We are all ears.
Hello, am I audible? Yeah. So one of the things I wanted to ask was regarding AAC. Because what I have seen is that the sort of level of technology we have for AAC in India is a little far behind as compared to like Western countries, and then also addressing like the lack of access that people from lower socioeconomic backgrounds face with regards to these things. So have you like how do you sort of not just educate parents about this, but provide them ways to sort of either do it themselves or find it at a reasonable cost?
So like three questions in one message, one thing. Okay, let me break this down because I like breaking down things. So first and foremost, AAC is not only devices, which I think we both acknowledge. Devices, AAC is all the way from what I'm doing. It's saying, shall I do this, or using your hands, gestures, all the way till eye tracking. I mean, that's like one of the most advanced ways of using an AAC device. Most commonly used are these apps like the Avas. So that's the first thing, that it's not only device. So that's the first part of the question I heard. Second part that I heard was technology is not there so much. Actually, I think India is like really there with technology. Technology in AAC is still there. It is about, like you very correctly pointed out, Vanshita, it's about families understanding and accepting AAC, professionals advocating for AAC from the beginning, not after 8 years and things like that. And so that's one piece of acceptance and those things. But I think if you ask us what we are doing, for example, we have all these fancy AACs in the department. So you are also welcome to come and see it and explore and use it. But if there are parents who are in doubt, and of course, Malavi, one of the things we didn't actually touch upon is the thing that not one AAC is not like for every, I mean, meaning each person, the choice of the AAC gestures, eye tracker, that will be different. So that's another thing, right? So what we do is once we get to know a family, we do the assessments, we understand, map their child's vocabulary, map the child's interests, they map the family's economic status, everything. We then make a recommendation for possibly this is the ACE. And if it is it's an expensive device, we've had families coming in and trialing it out with us in the department, and then actually making a purchase. So I'm guessing I'm answering the question about logistics there. And about awareness, I think like in many other things, we've got a long way to go with respect to awareness.
I think somebody has put up about the details. It is Anuradha Sharma. She has put up the details about where they can actually learn the sign language. Anyone who wants to can check that out. Thank you so much for the information. And yeah, anybody else, if anybody wants to ask this, we can take up final questions if someone wants to ask. Yeah, if
Hello, one more last question.
Yes.
It can be retrieved at the time of pregnancy.
Is that the question about autism?
Autism can be we can recognize at the time of pregnancy.
Okay, so my answer is going to be no to that. However, a lot of early signs can be seen before the first year. And in fact, that's one of the core areas we are doing research funded by the Wellcome Trust, but that's for another day to the conversation. At pregnancy, my answer, to the best of my knowledge, and I'm also looking at Dr. Nishanth, is no. But very early we can, but our average age of diagnosis, recognition, all that is much, much older. But we have some sensitive tools that are able to pick up by 9 to 12 months. And the other thing is we also know some children are at a different risk for higher risk, lower risk. So depending on that combination of things that we do, we are able to tell it a little earlier than what has been for the past many years.
Okay, thank you, madam.
I think I am sitting in the presence of the experts, so let me ask the question by myself.
I was not expecting that.
No problem. I think you talked about early identification a lot. I think the language and the communication is one of the part of the autism that is usually. I think it is the one of the part which is early picked up. I'm not sure whether it is the one that is picked up early. Let's say that if a person, if a child, people are able to pick it up at around 1.5 years or 2 years, what kind of interventions? I mean to say, should we intervene at that point of time, or what if at all we intervene, and what kind of intervention that we see? Sorry.
No, that's smiling, and I'm also smiling with Malavi because this is our favorite set of questions to answer.
Yes, please go ahead.
So detection is possible at almost the first birthday, but to be able to stably make a diagnosis, 18 months, 24 months is what we wait till. But then if we know that there are developmental concerns, autism, not autism, whatever in the neurodevelopmental, we say do not wait, preemptively start. If you know that there is something that's not okay, some doubt, start. There are simple things. In fact, one of the things that we've done as a part of the lab, Marty's PhD, big funding that came in was to develop this program for 9 to 15-month-old babies, where we are not going down that path of saying we will diagnose this child with autism. It may happen, but if they are at risk and there are signs, we start that. So 2 years, 2.5 and all for me is like, oh, I wish we could do it earlier. So to answer your question, Dr. Nishanth, it's possible to understand early signs. Definitely possible to say that there are neurodevelopmental concerns. We may wait till 24 months for a stable diagnosis, 36 months. But if there are concerns, we start language and communication intervention at the get-go. Simply because pointing starts by 9 to 12 months, gestures start at that age, carry me, waving bye-bye, all those things are language and communication. May not be still saying amma, but that is speech. We are going back to language and communication, which is like gestures, pointing. And if that's not there, do not wait for a diagnosis. Start at the get. And they're both, right? Parents also are given tasks to identify the child's communication, interpret it correctly, build on the child's existing patterns. And we also have specific goals for the children.
Yes, I think one of the concerns at the early age is, I think if someone talks about autism, the parents panic. The first thing is they panic, and I think they are so scared that they may not, at least they want it not to be true. They keep on trying that probably maybe in coming days it may change or not. But as ma'am suggested, I would definitely say autism, no autism, anything that they are able to identify concern. If there is a concern, okay, we don't have to label anything. I guess that's okay, and I would definitely it would definitely help the child and the caregiver to come to seek help and move forward, and it is the best way to go ahead, I think.
For all of you who have older children, like I already mentioned, a lot of families will be coming to you and saying, how did you go? What was your experience? How was it? Please advocate for earlier the better, and please advocate for you've gone through the process. They will also need their time. So I kind of understand where families come from, but earlier the better. YouTube tutorials are helpful. I agree. But I still have slightly that old school fashion where if you do it actually with a person who's trained in it, they'll be able to, like every other skill, developmental skill, we go step by step. They'll be able to walk you through that, help identify things that are not very correct, and then kind of build on that. I'm guessing this is all for the sign language piece.
Yes.
It's quite interesting. We give hearing impairment talks and we don't get sign language. And on this talk, which is all about NDEs, we got so much of it.
Thank you so much for your informative, wonderful, and enthusiastic talk, I would say. And I would. It was pleasure hearing both of you, and it was a very good Q&A sessions that we had. And from me and from ERS, I would like to thank you both again. And with that, we can end the session. If you want, or if you have any final.
No.
Okay.
Just want Malvi to be seen in the camera.
No problem. No problem. No problem.
Thank you, everybody, for participating. And remember, communication is a two-way process. While we try to help the autistic individuals, we also have to try and become more aware of how we communicate with them. On that note, thank you, everyone. Bye.
Thank you, ma'am. Thank you so much.
Yeah.